Hi, and welcome to the show. Subscribe at kevinmd.com/podcast and get CME for this episode by clicking on the CME link in the show notes. Today, we welcome Amna Shabbir. She is an internal medicine physician. Her Kevin MD article is titled From Womb to Burnout, a physician's reflection on the impact of maternal burnout on her journey. Amna, welcome to the show.
Thank you, Dr. Poe. I'm very excited to be here.
So we'll get into the article in a little bit. First off, briefly share your story and journey to where you are today.
Yeah, I am an integrative wellness and life coach for healthcare workers. I'm also a practicing geriatrician internist. I work in the post-acute long-term care space. Outside of medicine, I am a mom to two young girls, and that is one of the most rewarding parts of my life and journey.
Wonderful. So you mentioned that you're a life coach and a geriatrician. So professionally, tell me how you manage everything. What does a typical day for you look like?
Yeah, so right now in the post-acute long-term care space, I work in rehab, medicine, and nursing homes part-time, as well as dedicating the rest of my week really to my coaching practice, which I started this year. And it's geared towards healthcare workers, their journeys of wellness. And that's where I combine both integrative wellness and life coaching techniques. And this started as a result of my own personal journey through burnout. Between a residency and fellowship, I practiced as a primary care physician full-time, and during that time, I suffered from severe burnout. And I really wanted to pave the way for other physicians to start thinking about wellness conversations early on. So I work with medical trainees as well. This is where my passion lies these days.
All right, and let's talk more about that in your Kevin MD article, where we hear more about your story. It's titled From Womb to Burnout, a physician's reflection on the impact of maternal burnout on her journey. So tell us, how did your article come together?
This was a culmination of series of reflections as I undertook my healing journey. I wanted to pause and really think about how could I burnout proof my life moving
Mm,
forward? Like, what could I do? And that's really where I just paused and it hit me all of a sudden that my exposure to burnout really didn't happen when I started medical education. It started way before because I am the daughter of an OBGYN and I was born during her training year. She was an intern at that time and things were hard.
So tell us stories, examples, what made it so hard?
So my mom is an amazing physician, surgeon. What would I say? Like I think I'm 1/10 the doctor that she is. She worked all the way up until the day I was born, the moment I was born, rather. And I saw that the series of her journey like kind of play in front of me as time moved forward. She was in training. I am the product of a dual physician household. So my dad is also a general practitioner. And when I was born afterwards, my mother really struggled with keeping and honoring her commitments towards being a medical trainee as well as motherhood.
Mm,
So, what ended up happening was my grandmother, my maternal grandparents, I moved in with them. At that time, I was an infant. They lived one-way drive was about 5 hours away. I can only imagine how hard that was for my mother. And that kind of carried on all the way up until I was 5 years old. And my parents completed their training journeys, moved around the country, and finally, I moved in with them formally when I was 5 years old.
mm,
Uh, and things really didn't change a whole lot at that time either. So when I moved in, I recognized how hard my mom worked. And the word burnout never came
yeah.
out of her mouth. Like the word stress never came out of her mouth. Like all she wanted to do was really care and give and work. So she gave at work and she gave at home. And so when I was reflecting, like, what can I do? And it really like struck that, okay, my exposure happened at that time. And then I started developing these internal feelings towards her. I feel like I have a more complicated relationship with her. And then the more I underwent my personal journey in medicine, as I became a mom myself, I felt I recognized and I understood her struggles so much more. So the article was really me leaning back towards my mother and my younger self and saying that it's okay as we kind of navigate out of this burnout.
So, as your mother, as a busy obstetrician gynecologist, and like you said, burnout wasn't spoken as widely or recognized back then. Talk about the stress that had on your family when you were younger.
So my mom loves her patients. Like that is 9 months journey with her patients. At the end, she always wanted to be there for them. So what I felt as a child was that she preferred them over me, like basically in a
Mm,
nutshell. And I feel like I innately developed this dislike for procedure-driven specialties, although when I was going through medical training, I loved procedures and surgeries, but the lifestyle aspect of it really, was a big turnoff for me, so I didn't pursue any procedure-based specialties, and I wonder how much of that had to play in with my decision of primary care. Like, I loved it being a general internist, but at that time, I also wanted to have like a quote unquote 9 to 5 job. So I feel that it had a deep impact in me feeling disconnected from my mother, me not wanting to do a procedure based specialty, me then later deciding to have a spouse that's outside of medicine. My husband's not a physician. So there was just like a series of small changes that kept happening. And I feel that my guilt was way more magnified when I underwent burnout myself because I asked my internal dialogue was, "You should know better, Amna. You should know better because you know exactly how your children are feeling right now because you were them once." So that really magnified my mom guilt.
So it sounds like during your own medical journey, at least you had the insight of not repeating what your mom did and hopefully not replicating how you felt in your children. Is that right?
That is correct. I tried. I tried, and yet I found my own, I would say, my own unique pit of burnout because we can try to be as resilient. We can try to, you know, resilience almost sounds like a trigger word at this point. So we can try to do what we can do, but sometimes you just find yourself exhausted and tired in the middle of a pandemic, and you're doing way more. Our primary care physicians work so hard. So it was at that moment I really had to pause and ask myself, am I going to just keep going? Because my mom just kept going.
Hmm.
Like she tapered or decreased her work hours when I was finishing medical training. So she just kept going and she's still working. She's working reduced hours now, but it was very difficult for her culturally and otherwise to have this conversation because work was tied to morality almost. So when you said you're going to rest, it almost sounded that you were attacking morality when you're taking a break.
Have you ever had these conversations with her in terms of her reflecting, in terms of the choices that she made? I know work life balance isn't as spoken back then as it is now. So, did you ever have these conversations with her and kind of a more reflective phase now, the fact that she is towards the end of her career?
I love that question, Kevin. So I recently, actually, a few weeks ago, I would say, was the breakthrough conversation after the article was published. I sent the article to her. There were briefer conversations before, but when she saw it all in print, I think the impact that it had on her was very magnified. So she sat down with me and I felt bad because she apologized, and then I had to have a different conversation because I said, "I get it, I get it, mom. I get why you did what you did, and how can we make things better?" And I think it was a very beautiful moment where she was able to acknowledge and share some of her struggles, which I did not know, and I was able to share my struggles as when I moved out of an academic institute and went part-time, it was very difficult to share that with my parents. So she was able to recognize why am I doing what I'm doing and why I'm advocating for wellness the way I am right now.
So, you said that when you moved from full time to part time, it was very difficult to share with your parents. Was it because of your parents' viewpoint in terms of work equals morality? Why was it so difficult?
It was more of everything that I had soaked in from the environment that I saw that made me feel that this was not something, first of all, that I should say. So there was that internal narrative. And I had a bias against my parents and this was my bias that I will not tell them, that they will not understand because of what I had seen. But the moment I was actually able to sit with them and I was able to share my struggle, they saw what I was going through, what it was doing to my family. And I think that that internal narrative that was there was my own, and in my case, the story played out better. Now, yes, it was based in past conversations where grades and academia were very highly encouraged. They're both physicians, and, an academic physician is the best kind of physician, the most virtuous physician, for lack of a better word. So I think that that shift in perspective required time, and they saw that with time, what I'm doing why it matters, but it was a process. I would say if we don't open that conversation with our parents, we can never get to that.
Now, despite the observations that you made on your mother and the effect that it had on you growing up, you yourself had a journey into burnout as well before you cut down and became part-time. So tell us about your own journey and what kind of signs did you recognize to make you realize that you were entering that phase of burnout as well?
Yeah, I honestly never thought that the word burnout or moral injury would be in the same sentence as me, because when I started primary care, you can ask any of my colleagues from residency, I loved primary care and I felt so passionate. In fact, I was the only person in my class that graduated and did full-time primary care at that time. But I recognized that within the first 3 or 4 months, I was burnt out. And as I reflect back, recognized that at that time I didn't know. I equated it to overwhelm and the fact that, I'm new and I was a resident 4 months ago and you just have to make this work. So I think that the first sign that I had was the feeling that I don't have any autonomy. And that was very resounding. I felt that I wanted to make changes and I couldn't, and I wanted to make impacts in my patient's life, and I could not to the extent that I wanted to, which then started to eat into overwhelm. I think that did hit a phase of depersonalization where I felt that I was trying to get to the end of my day and basically running through my patient appointments so I could get to that point. So it was very different. And the when did I realize that yes, it's burnout for sure was when I was consistently sitting in my car, giving myself pep talks after listening to multiple positive podcasts and songs, and you can do this, just get through the door. Like that was the moment where I realized, okay, something has to give, something has to change. And I think the pandemic has had a big role in that phase coming. And I had some personal health challenges as well, so it was all happening at the same time.
So you said that within the first 3 to 4 months, you realized that you were burnt out and there was a lack of autonomy. So give us a specific example. Was it too many patients at work? Was it the work situation? What would be an example of that?
I think primary care as a whole is just, and it can be any institute, the expectations that we have from our primary care physicians are very unrealistic. We want them to see a 15-minute visit, a 20-minute visit. So what was happening was I would have an example would be, Kevin, a day where one patient shows up late, then another patient shows up late. There's no late patient policy, and I'm expected to see all of them. Then I see them. Of course, I want to do justice by my patients. They cannot be seen in 20 minutes. They cannot be roomed, checked in at the front desk, fill in all the intake questionnaires, seen by me, have good medicine practiced, and then leave. So then what would happen is at the end of the day, the entire staff would have gone and I would be in the office till about 8, 9 p.m., answering all the my chart messages, finishing up my notes. And that's when I recognized, okay, this is a lot. This is a lot. And we talk about burnout in training,
Hmm.
but what about burnout that happens in early career physicians when they're trying to navigate that bridge that's happening?
So now that you've had time to reflect, is there anything that you would have done differently, just knowing what you know now?
I would have been less tolerant. And I know that this is a word that can be phrased in many different ways, but there are lots of things that we tolerate in our life and we create tolerations for. I think my toleration was that I said, it's okay that my internal feelings were not as valuable as the larger issues or the larger good. But what that did only was suppress the issues that I was experiencing, and it just perpetuated and snowballed later on. There was a point where I felt like I had to leave medicine completely.
Hmm.
So I am very glad that I did not. I further had moments where I created and shifted my own narrative. I found coaching, and that was one of the things that allowed me to have that dialogue. And really, I stayed in medicine. I recognized for me, caring for older adults gave me much more joy and meaning. So when I was looking at my patient panel, that's when I realized, okay, that's why I want to pivot and do fellowship. Fellowship had its own challenges. Becoming a trainee after being an attending was also interesting. But I think what I would have done differently was I would have been less tolerant.
So you mentioned that you're now part-time clinical and you see coaching clients. How are you doing now?
I am doing well overall. I think that burnout can be cyclical. So right now, my reflections are all based around what can I do better and how can I be in a system where I can advocate for change. So my day to day looks like, I'm working with my predominantly geriatric patient panel in the nursing homes a couple of times in a week, and then I see patients for subacute rehab. I really thoroughly enjoy that work. It gives me a lot of satisfaction and meaning. And when I'm with my coaching clients, we're working about systemic changes and all the issues that I had. So I feel that I am addressing both the person that was burnt out and both the clinician in me. So it's a very rewarding space to be. I'm involved with the American College of Physicians North Carolina Chapter Wellbeing Committee, and we're launching the first ACP Wellbeing Town Hall. So I'm very excited about that. So initiatives like this really give me purpose and drive to just keep moving forward.
And what do your parents think about your career situation?
They have now come to recognize that I have made some really good choices. Initially, they see it in multiple steps. I feel my mom especially was the one who was, you have very career driven, and she was very focused on outcomes and what I do in life. So she recognizes that maybe the way we define success needs to change a little bit. Maybe the definition of success is not just academic accolades, it's also the amount of time that you spend with your children, the value that you bring at home, and how you see yourself in general, like how wholesome is your life. So I feel that now they're more accepting, and I am more accepting of the fact that they're so accepting, because again, like I'll bring it back to the point that being raised in a culture and family where everything is so academically charged is, you just put a lot of internal pressure. So I would say to anyone listening to this, please question. Maybe your parents don't think the way that you think that they're thinking.
We're talking to Amna Shabbir. She is an internal medicine physician. Her Kevin MD article is titled From Womb to Burnout, a physician's reflection on the impact of maternal burnout on her journey. Amna, tell us some of your take-home messages that you want to leave with the Kevin MD audience.
I would say that if there's anybody now thinking that they are burnt out, a clinician who's feeling that way, please know that you probably burnt out a while ago and now you're truly appreciating it. So this is the time to ask for help. And help can be in many different shapes and spaces. So it could be talking to a friend, it could be reaching out to a colleague, a coach, a counselor, a therapist, or all of the above. But please ask for help. My second advice would be please create some pause and white space in your schedule, even if it is 30 minutes, 1 hour, half a day. And really ask yourself, can I get a sabbatical? Can I get a few weeks just off to myself where I can allow the noise around me to die down, where I can maybe sleep and ask myself when I'm refreshed and in my basic physical needs are met, what am I doing with my life and what do I want to do with my life? So sabbatical healing and creating white space is so much important. Specifically, when we talk about women in medicine and mothers in medicine, I would urge all my colleagues to ask yourself and look around you, are you creating a good space and advocating for mothers in medicine? What does the maternity leave, paternity leave policy look like in your institute? How much postpartum support is present for those female physicians and surgeons when they come back? Are you allowing them to work part-time if that is something that they're interested in? Everyone is not interested in that. Are there options for emergency childcare if that needs to be an issue? And especially for medical residents and trainees, like if they need emergency childcare, their training is impacted by that. Are there spaces for it? And lastly, for any physician mom listening to this, I don't have any advice for you because you're already doing a great job. So just know that. And please take time for self care because if you care for yourself, then you will parent better and you will doctor better.
Amna, thank you so much for sharing your story, time, and insight. And thanks again for being on the show.
Absolutely. Thank you, Dr. Bo.